Welcome to Good Friends, Good Medicine, East Meets West podcast. My name's Dr. Tom Rowley, and I'm joined by my good friend TJ Frank. TJ, how you doing today, buddy?
Aloha, Tom. Hi, it's TJ Frank, licensed acupuncturist, master of Chinese medicine, residing and practicing in Maui, Hawaii, and talking to you from there today.
Beautiful.
Aloha.
Aloha. Yeah, I'm currently in my house in Broken Head. I work in Mullumbimby as a GP, general practice, and excited for today. I think we got the topic of Parkinson's disease, which I'm very curious around. I feel a lot of excitement about the synergies and what's going on. So shall we jump in?
Go for it, Tom.
All right. So Parkinson's disease. Look, some epidemiology. I thought I'd jump in on rare under 40 years old. So this is a disease of over 40s, and current incidence is around 1 in 1,000 people. So it doesn't seem like much, but when you put it on the population of the world, it's a lot of people. I think I saw like 7.5 million or something. There's a lot of people on this. From a Western perspective, it's a progressive neurodegenerative disease, and it's got a couple of key features of it. One is it's a motor disorder, so movement becomes challenging, and there's also some neuropsychiatric features as well. It was first found out back in 1817 by James Parkinson, who's under its name by, and wrote about it, the essay on the shaking palsy. And it was noted, I did find this cool fact, it was actually noted in Ayurvedic medicine as well, called Kampavata, which translates as shaking and rigid, which is pretty much spot on for it. And their treatment actually had levodopa in it. So jumping a little forward, but anyway. Cause from Western perspective, unknown, but pathophysiologically, got some interesting features. It's basically a dopamine depletion from a specific area of the brain, and you get a couple of cardinal symptoms. One is a resting tremor, so it's at rest rather than other ones where tremors with action. So that would be an action tremor, moving the cup, but a resting tremor, and classically it's a pill rolling. So they kind of get their thumbs going. The next one is slow movement. So they got slow movement, and then the last feature is rigidity. So the joints or the musculature becomes rigid. So those three features: resting tremor, slowed movement, and rigidity are the key features. And then late in the disease, they get postural instability. So this means they're more risk of falling, but that's a late sign. Interestingly, the patients may describe an internal sensation of the tremor before it's actually visible. And a couple of classic things is shuffling steps. So as they walk, they're shuffling. And also difficulty getting out of the chair. So that also could be an interesting finding. They classically get stooped as they go along, so it's a very the gait, they kind of fall forward, bend forward, and then shuffling gait. And additional features are there's a bunch of them that could be going on. So it's linked to dementia and psychosis, sleep disturbance, anxiety, depression. But interesting one, like a mask-like face. So the face becomes like a mask, and also their handwriting becomes small. So it begins big and then it gets very small. And that's they're two kind of cardinal features as well. When we chop open people after they've died and they've had Parkinson's disease, there's these Lewy bodies. They're called Lewy bodies that are like a conglomeration of proteins that are bound up in that area of the brain. And there is another disease called Lewy body dementia, and that's more of a dementia, but they can have Parkinson's features. So some people feel like these are two ends of one disease. So at one end it can be more Parkinson's-like with the shaking and the rigidity, and on the other end dementia. And then as they go, there'll be some crossover features. Interesting ideas around what's going on. So the Lewy bodies as a possible cause. There's ideas around mitochondria, which are like the energy centers of the cells, leading to problems. There's a link to pesticide use. So a particular pesticide called rotenone, if they inject that into rats, then specifically that area of the brain involved in Parkinson's dies. And then also iron metabolism might be involved. So hemochromatosis patients or people with iron problems may be at risk of this. Prognostically, it's not a great disease. At 10 years, like a lot of people are suffering from it, either from death or psychosis or trapped in a wheelchair. And that's kind of an overview of this disease from a Western perspective. I'd be interested to see how you see this one. What do you got?
Right on. So as an ambassador of Chinese medicine, we consider this what's called an internal wind initially. It's broken into two main phases, the initial phase and the later phase, similar to how you're describing. The initial phase is with the resting tremor, and the later stages is the rigidity in the postural. The initial phases is rooted in deficiency, primarily deficiency. It starts with deficiency of kidney and liver yin, especially liver yin. That's what starts the tremble, is the kidney liver yin deficiency. And as the liver yin becomes deficient, which is the cooling, still, moist aspect, the liver gets hot. And through the heat is what makes the tightness of the tendons and the agitation of the tendons and the tremble. And the lung is the thumb, and the liver wind clears from the liver through the lung. So that's why it expresses through the lung. It starts with liver yin deficiency, which leads to kidney yin deficiency. That gives rise to a liver yang rising, creating the wind, and then that clears through the lung, creating the pill roll. That's all initial phase. Once this goes on for a long time, the yin becomes so depleted that it provides the viscous fluid nature for the blood. And eventually, if the yin becomes so thin, the blood starts coagulating. The blood starts to get thick, and that's what leads to the body tension. That's what leads to the stiffness in the body. At that same time, the liver gets quite agitated because the liver is responsible for the smooth movement of qi and blood. And if the blood's getting thick, the liver gets way backed up. And then that backed up energy not only goes through the lung as before, but it also goes through the digestion through a middle jiao disharmony. And the liver excess is processed through the spleen stomach. And then the spleen stomach goes way down in function. And then there becomes a retention of phlegm in the body. The phlegm in the body is what leads to the dementia, the stone face, the coagulation in the brain. That's all secondary. That's the second stage. The rigidity and the lockup is the blood stagnation and the phlegm accumulation. Therefore, the treatment principles are much different in the beginning stage versus the late stage. That's an overview of the pathology of Parkinson's from a Chinese medicine perspective. Now, within the 8 principles structure, within Chinese medicine, we treat root conditions of a person's, we treat a person's root condition rather than the branch of what's going on. So we don't look at it as Parkinson's. We look at it as anybody else. Pulse, tongue, anamnesis, do questioning, palpate, smell, feel. And through our diagnostic system, we use, is this excess or deficiency, internal, external, hot or cold, yin or yang? You've heard me say these before. So we apply that same model regardless of what symptoms we're treating or what syndrome we're looking at. And in this case, the external factors are wind, cold, damp, heat, and dry. You've heard those before. And this one, especially wind. So people that live in windy environments, people that ride bikes while they're sweaty, old people, they say in Chinese medicine, 50% of our yin is depleted by the time we're 40. I see 60-year-olds riding bikes out there in the heat, sweating, just sweating buckets. They're depleted on yin, and they're just squeezing the yin out. And they're out in the wind with their pores all open, sweaty, and the yin's coming out, and the wind's coming in. It's the worst scenario possible for Parkinson's development. In any case, so external wind is the component. The Chinese medicine sees the body as a particle cloud, and if there's a lot of molecular movement on the outside, it creates increased molecular movement on the inside. The internal excess, there can be internal wind as well from liver, somebody getting too angry for too long. Just, even with somebody, they start trembling. So holding on to anger and frustration too often and too long can create internal wind. The yin also subdues the yang. So somebody overworks and exercises too much, has too much sex, takes hot, spicy, greasy foods. They're just doing all this heat stuff. In overactivity, they'll deplete the yin. The yang won't be contained, and the yang will become floating, and the yang will create wind. So that's the internal excesses. The deficiencies of the internal are the yin deficiency that I've already spoken about with the kidney and the liver. And then eventually that leads to, if there's not enough yin, that's the fluid in the body, there's not going to be enough blood. And then if there's not enough blood, we get into blood excess or blood stagnation. So there could be blood deficiency, but eventually that leads to blood stagnation, which is an excess. So that's the external, internal, in excess deficiencies. Hot and cold, this is an interesting one with Parkinson's. It clearly delineates the first versus the second stage. In the first stage, they're hot. They either got true heat or deficiency heat. Whichever one, they get agitated and their symptoms are worse with heat. In the latter stages, they're deficient and they're coagulated, and cold makes them worse. And they have an aversion to cold. So first stage, they have aversion to heat. Second stage, they have aversion to cold. So that's an important differentiating factor. Now, when we get to treatment, this is essential, because if somebody has got excess heat, you can't heat them up. It'll make them worse. In the latter stages where they have stagnation and cold, they'll often treat with warming herbs in the latter stage. If you treat a first stage person like you treat a second stage person, you'll make them worse. So that's where the hot-cold differentiation works well in this particular syndrome. So that gives you an overview of the 8 principles. The 5 clear syndrome differentiations that we work with in Chinese medicine after we've done our assessment and we've pushed them through the 8 principles, the thing that comes out of the machine is they're either going to be a liver yang rising, a liver yin deficiency, liver wind excess, kidney deficiency, or blood stagnation. Those are the 5 differentiating principles. In all honesty, it's rarely one, and it's rarely one clearly. It's usually a relative balance between these. As I mentioned, the liver yin deficiency leads to liver yang rising, and that leads to liver wind. Mm-hmm. All of these eventually deplete the kidneys, which leads to blood stagnation. So the 5 syndromes are closely tied together. And that's how we see it in Chinese medicine.
So, a couple of quick questions. So, what with the say the anger excess or the hot spicy foods, they're burning up their liver's hot, it's rising. Is that causing the liver yin to be depleted, or are they? Uh-huh. Yeah, right.
Hold that for 20 years and see if it burns you out.
And once
people with a preponderance to that activity, it does deplete their yin. They don't get to rest. They have to be cooled and nourished and held and slobbered on. That's yin.
And so, like, let's say they hold it for 20 years. They'll then shift from being anger to like then getting liver yin symptoms, or they stay angry? Like,
the anger gets worse.
The anger gets worse, right? Because there's less and less liver yin to.
Well, because the liver becomes. I mean, the liver yin deficiency signs start way before there's Parkinson. There's going to be dry, brittle nails. There's going to be tight sinews. There's going to be muscle tendon problems. There's going to be tight jaws. There's going to be early graying of hair. There's going to be thinning of tissues. I mean, there's a lot of ways to see when the grape has gone to the raisin. That's what we're talking about here. So the drying of the body will become apparent before the wind in the tissues presents itself.
Nice.
But the anger, any of the emotions, are a reflection of the well-being of the organs. So the anger, it's a chicken or the egg.
Yeah.
The liver's not healthy, so they get angry, and because they're not angry, the liver's not healthy. And then they get more angry, then the liver's less healthy.
Round and round it goes.
And it gets worse.
I got a second question. I don't know what you got on this, but I'm going to put it out there anyway. It's probably the second stage, but there's two classic findings in terms of the rigidity. One is a cogwheeling, where it goes up, like as I push on their arm, it cogwheels, and the second type is it's a lead pipe, so it's hard and then it collapses. And there's these two very, classic kinds of rigidity. Do you have any? I know this is on the spot, but
on my shot from the hip on this, the cogwheel you're actually moving there's stagnation in the channel, that it's moving through the stagnation. The lead pipe, the channel is fully locked, and as you move it, you're breaking the channel. You're just folding the pipe the meridian is so blocked with phlegm and blood. At that point, it's just not moving. Then the pipe just breaks. The cogwheel, there is blockage in the meridian and obstructions in the channel, but the channel as a whole is not locked yet. Cool. I would presume the cogwheel is probably an antecedent to the lead pipe.
I don't know, but I would
presume based on this my understanding of the body. I don't know.
Yeah, interesting.
Yeah. It'd be interesting to see.
Cool. That's all right. Very interesting. Super. I love the link to the lungs with the thumb. It's such a classic sign to see that wind coming up, clearing through the lungs, and then it's showing in there. It's really, really awesome.
And it's just primarily, it's in the sinew. The liver gallbladder dominates sinew, the connective tissue, the fascia. Each organ dominates the growths of different tissues. The spleen, stomach's responsible for muscle. Kidney is for the spine and the brain, which is beautiful because when the kidney gets depleted, eventually it leads to the dementia, and as well it leads to that forward arching that you're speaking about, because the kidney strength and the kidney yang is what holds the spine erect and the mind filled. Like, we take all sorts of warm, spicy kidney tonic herbs to stimulate the spine and the brain. To that note, there's this, you said, in the 1890s, Parkinson's, formed this syndrome. In China, there's a Dr. Zhang Lu in 1695 described this syndrome and created a special formula for it in specific in 1695.
Wow. That's
Jiawei. Yeah.
What's interesting for me is that was it not known before? Chinese medicine's old, right? It's So it's interesting that in 16, it doesn't appear until 16.
No, that's when it's described in specific. But so all the doctors, they had a base of medicine, but as they went through, people would specialize in fields. Often they specialized in response to natural phenomena that created a pressure. So there's a period with a whole epidemic disease of viruses. So a lot of doctors studied warm disease. So there's these treatises on febrile disease that came later in the evolution of Chinese medicine to meet the natural needs of the environment. This is just some doctor at some point specialized in creating a formula to treat Parkinson's in 1695. And he wrote a treatise on it, and he came up with the formula, Jia Wei Liu Zhen Tang. Jia Wei Liu Zhen Tang, a modified six gentlemen's decoction. This is only a formula for late stage. It's got a bunch of spleen herbs and warming herbs and ginger and warming herbs to break up the blood stagnation, warm up the kidneys, drive the pressure up into the brain, and stimulate the brain. If you gave that formula to an early stage person, they'd get much worse.
Much worse. You're going to potentiate it. Well, let's jump into the Western treatment that I got.
Okay, tell Mom.
Alrighty. So overview. We got three main areas: pharmacological, non-pharmacological, and then surgical. Actually, can come into this as well. So from a pharmacological point of view, the main ones are levodopa, which is pretty much straight dopamine. You need a decarboxylase inhibitor, otherwise it gets used in the periphery, and that gives you a bunch of unpleasant side effects: nausea, vomiting, hypertension. It works really well on the slowed activity, the bradykinesia. But it's got some interesting side effects: nausea, sleepiness, dizziness, headache, and rarely hallucinations and confusion. So its main complication is that after some time it starts wearing out, and you get motor fluctuations. So it'll be on for a set period of time, and then it won't be working, even though they're taking the same dose. So this is a wearing off phenomenon. Beyond that, we got some dopamine agonists, similar, probably a little less strong than the levodopa, and the options would be usually used in earlier patients. So it's less effective, but they get less motor fluctuations. And the last one, well, not last one, other options, MAO-B inhibitors, anticholinergic medications can both be used. And the anticholinergics are around, basically there seems to be a link between how much acetylcholine there is and how much dopamine there is. And if you increase one, the other will decrease. So if we block acetylcholine, then the relative effect of dopamine will come up. Unfortunately, side effects of these: dry mouth, constipation, urine retention, and also there is a link to memory impairment, so rarely used in older patients. Around non-pharmacological, then these would be basic things like education about the disease, support, and this would heavily be for caregivers. And also around the emotional response to the diagnosis itself. How's that patient going to take on knowing that where this disease commonly leads? So they recommend exercise, probably not cycling in the wind, but gentle walking. Gentle walking is where I would be good. And it appears to decrease the rigidity. So even though it doesn't seem to slow the disease, it limits the orthopedic effects of frozen shoulders or hips locking up. So they may need speech therapy. Swallowing becomes a risk, and also speech becomes difficult. And then nutrition, they're at risk of poor nutrition and weight loss. So having a look at nutrition and making sure that they're getting enough nutrients. I'm sure you're going to cover diet therapy as well. So I'd be interested to hear about that. Dropping into late stage, there are some surgical therapies for this, and this would be deep brain stimulation. So to counteract the levodopa's effects, so let's say we're 10 years down the track, they're getting 4 hours where the medication works and then 3 hours where it doesn't. They found that originally they would go chop out part of the brain, and that would release part of the inhibition, and they'd get improved symptoms. But more recently, there's been placing stimulation, electrical stimulation, into the brain itself, and this actually can help quite a lot for these patients and give them an increase of up to like 4 hours a day of actually having the medication work. The downsides to having something placed into the brain, so you've got maintenance issues, you've got to tweak the settings quite a lot in the beginnings, you've got battery problems, leads breaking, and there's an ongoing infection risk. Nonetheless, and in the studies where they put the brain stimulators in versus just straight medical therapy, they have this 4 hours plus of increased function and a better quality of life. Yeah, so pretty intense, but it is an option, and the results seem to be reasonably good. So yeah, that's the overview. Pharmacological, dopamine is the main basis of therapy. So going to where the brain is depleted in dopamine and increasing that, so the function, but eventually that brain appears to continue to decline, and even with increased dopamine, it doesn't have enough effect. And then that's where the role for surgery. But that's probably a 5 to 10 year delay from initial diagnosis. So it's an overview of treatment from my perspective.
Right on. Thanks, Tom.
No worries, mate. What do you got? Let's interested.
So Being that a predominance of the world's population lives in Asia, most of the Parkinson's clients in the world are treating Parkinson's with Chinese medicine and herbs, which is interesting. In my culture, I don't think of it as that, but honestly, in the world, there's a lot of treatment happening with alternative medicine today, and as I mentioned, for quite some time throughout the past. So there is hope alternatively. Um, just as a preface, I was going through reading all the research. I mean, it's just amazing how many people are under the therapeutic care of Chinese medicine for Parkinson. There's a lot of data, there's a lot of research, there's a lot of different therapeutic interventions that have been used for quite some time. And that was news to me, so I forgot to share that. With Chinese medicine, there's 5 therapeutic branches, and those are diet, herbs, acupuncture, movement therapy, and massage therapy. Any one of those 5 branches can be used in any condition. Within each of these different syndrome differentiations, different ones have different effects. In specific, what I'm saying here, typically the Chinese herbs treat the conditions, the deeper constitutional things, the yin deficiency, the blood stagnation, the yang rising. The acupuncture is used to clear the wind itself, typically. So it's usually in this case done both, acupuncture and herbs simultaneously. The intervention is often, every day, every third day at the minimum. It takes a lot of acupuncture to clear wind internally. But that's how they typically do it, as a 1-2 punch, herbs and acupuncture. Diet therapy, sure, less greasy, less spicy in the first stages. In the later stages, more spicy foods and warming foods. Gingers, peppers, turmerics, those type of things. Blood invigorating herbs as well. Dong Gui can be cooked with, and that's used often. So initial stage to tonify the yin and keep the yin going. Lots of grapes, watermelon peels, white, viscous, thin type of foods, coconut meat, oysters, those type of things tonify the yin. You can look up foods to tonify the yin, but the initial stage we need to tonify yin dietarily. But once again, diet's going to help to conserve the yin. It takes, to build yin, it's easier to conserve yin than it is to rebuild yin. Once the yin's lost, it takes a while to build it up. So behavioral lifestyle, getting people to rest, getting people educated to not exercise in the peak heat of day, getting people to sweat to a minimum, not to an excess. Ways to preserve the yin: no oversex, sleep when it's dark, wake when it's light, don't stay up all night long, don't burn the midnight oil, all these common things we say in our culture. Conserving the yin, an ounce of prevention is better than a pound of cure. Once the yin's depleted, you can tonify the yin dietarily and herbally. It takes a long time. And to build the yin is sticky, so it's got to be circulated. So to build the yin, it takes a pretty sophisticated, savvy herbalist to tonify the yin without creating coagulation and stickiness in the body. The later stages, herbs are the way to go. Herbs are definitely the way to go. Diet will help herbs. So to that note, with liver yang rising, the formula I've talked to in the past, Tianma Gotang Yin, I've brought up to you in the case of vertigo and dizziness. You're now going to see it again in Parkinson's. That's interesting. Multiple different conditions, one formula. One condition, lots of different roots. Chinese medicine's different. Parkinson's could have 5 different causes. But one formula can treat 3 or 5 different diseases if it has the same root. So liver kidney yin deficiency, Li Wei Di Huang Wan, is a wonderful formula. And if you got yang rising on top of it, then you go to Tianma Gotang Yin is a beautiful formula to nurse the yin and settle and stabilize the wind. Kidney jing deficiency, once again, that's an oversex thing. Less sex, more rest. Tonifying the kidney jing is difficult. Dietarily is actually an okay way to go with kidney jing. Black bone, chicken, bone broth, kidney beans, kidney soup, kidney pie. These type of things help tonify the kidney. The Chinese are a little more liberal with their diet than we typically are. Blood stagnation, massage works really well. The massage can also be really good to release the wind. I use this, I'll define releasing the wind. That also could be subduing the neurological system, pacifying the nerves, touching the nerves, going down the nerve pathway slowly. There's this acupoint. Oh, God, did I write it down? I did. Xiao Chan Shui. I found this extraordinary, this extra acupoint, 1.5 sun below heart 3 on the arm, right at the plexus as it goes through the antecubital fossa and stimulating the nerves in the forearm to reduce the tremors. So we stimulate the nerves to sedate the nerves. Massage can do that as well. There's also a series of acupoints that are extremely potent for wind. That's one on the forearm, on the leg, liver 7, spleen 8 are good wind clearing points. And then for the head, stomach 8, gallbladder 20. So it depends, if the Parkinson's just on the hand, we'll massage and needle the arm. If it's on the leg, we'll massage and needle the leg. If it gets up into the brain, then we start needling towards the head. And to that note, as far as the internal stimulator, we as well use stimulators on the brain. And we found that there's something called the tremor zone, a 1/2 inch in front of the motor sensory cortex. So there's a way to find the motor sensory cortex in the brain, and an inch in front of that, following the homunculus, if they're contralaterally. So if it's a wind tremor, we do the opposite side of the homunculus where the hand would be, a 1/2 inch in front of that, and then we stimulate it with electricity to reduce the wind in the hand. So there's a lot of research out there, primarily from Japan, using scalp acupuncture for the mediation of Parkinson's clients. And they're doing these scalp zones and getting tremendous results. So there is symptom mediation with scalp acupuncture, but it's just symptom mediation. Unless the internal roots of liver yin deficiency, kidney yin deficiency, kidney qi deficiency, blood stagnation, or accumulation of phlegm in the body, those have to be treated to have any lasting effect. Stimulating the brain is going to help in the short term for 4 hours or more, and it has to be done so succinctly. It has to be done a lot because it's just a short duration. The root also has to be addressed for profound therapeutic change. So that's the basic overview for where I'm looking at. Massage the acupoints to clear wind, massage the nerve pathways to sedate the nerves, get them on diets that balance their constitution, and get them on an appropriate herbal formula that meets their syndrome differentiation based on which phase of the disease pattern that they're in. If it's a liver yang deficiency, get herbs that sedate liver yang. If there's liver wind, herbs and acupoints that clear liver wind. If it's kidney deficiency, herbs, diet, and movement, qigong, and acupoints that tonify the kidneys. Go needle bladder 23, kidney 3, points that tonify the kidneys. And for blood stagnation, promote smooth movement of the blood through. If there's heat in the blood, you got to clear the blood. If the blood's thin and dry, you got to moisten the blood. You got to move the blood based on why the blood is getting stuck. Shui Fu Juyu Tong is our banner formula to promote blood stagnation, as is Siwu, Tao Hong Siwu Tong. Beautiful formula for blood stagnation. Also a very popular gynecological formula. Each of these syndromes are going to be easily differentiationable through tongue and pulse. The liver yang rising people, they're going to have a floating pulse that has nothing under it. The liver wind people, the pulse is going to be full all the way through. Both the liver yang and the liver wind are going to have the deviating tongue and the quivering tongue. The liver yin deficiency people, they're going to have a thin, thready pulse. It's not going to be floating. It's not going to be full. It'll be thin, thready, and their tongue will be thin and red. It won't be deviated in like the liver yang and the liver wind people. The kidney qi people, the kidney qi deficiency people, they're going to be listless, dark circles under their eyes, pale tongue, thin, thready pulse. The blood stagnation people are going to be irritable, jerky, stiff, cogwheel movement, choppy pulse, blue-purple tongue, and a choppy pulse. So that's where tongue and pulse also helps within the differentiation. And then through differentiation leads to easy treatment because treatment follows a good differentiation.
What are your outcomes like in this? I mean, would you see, like, once they're at late stage, like in the second stage, can they be brought back, or is it more like just maintenance?
Most of the researchers, the studies I was looking at, it was about a 1/3, 1/3, 1/3. 1/3 improved, 1/3 held, 1/3 progressed.
Okay, that's pretty good.
Is what it seems. Yeah, that's not bad. That's not bad. You know, considering the levodopa is a wonderful intervention and a marvel of medical science to contribute to humanity, but unfortunately, the long-term use of levodopa leads towards tremors, trembling, muscle clonus, and dementia. Yeah. So unfortunately, the side effects of the levodopa is actually a boon to me because it's driven so many people to look for alternative. Like, great, these therapies are great for a short term, but if I take them for a long time, it's going to worsen the situation. I need to find something else to do. So then a lot of people turn to alternative medicine in the West. In China, in Korea, in Japan, they start immediately with the Chinese herbs. And if that's the case, if somebody appreciates what's going on and understands the pathogenesis, then they can intervene with lifestyle change and the progression won't progress. Yeah. If they know this is a liver kidney yin deficiency, let's just tonify the liver kidney yin, eh? Before we get to liver yang rising, before we get to yin depletion, and blood stagnation, to the point that they're in clonus and hunched over.
So, yeah.
So it depends how early we get them.
Yeah.
Depends how, I mean, of course, the more advanced it is, the harder it is to reverse.
Yeah. Yeah. That's cool. Yeah. So it's great to think that you could pick it up early enough that they don't progress to Parkinson's. You know, it's like,
keep an eye out for liver and kidney yin deficiency. That's the root. That's the root.
It's excellent. Yeah. All right. Any concluding remarks? Look, it is amazing to like what would be the combination. I mean, where can they, if the levodopa, it buys them some time, but like the longer term consequences are not great.
In my experience working in China, they mix the herbs and the allopathic drugs in the same pill physically.
Really?
They're not shy. They boil the herbs and introduce the herbal decoctions into the IVs and then administer them with Western meds via IV.
Oh, wow. Really?
They're fully integrated. All the Western doctors in China, by and large, know Chinese medicine, and all the Chinese doctors know Western medicine. For them, it's just medicine.
Why? It's just medicine.
Why the competition? Let's just peak outcome for the clients. That's the goal.
That is spectacular.
We don't have to farm sick people. There's enough of both of us to be busy the rest of our lives.
Absolutely.
The baby boomers are aging, and they've partied, and they've lived hard, and they've stayed up late, and they drank alcohol and coffee, and they worked hard, and they didn't rest. They took holidays, and they didn't know about yin consumption or yin conservation. As these baby boomers are older, a lot of them are starting to dry out, and as they're drying out, they're getting more windy. It's something they should be aware of.
Well, hopefully, if this podcast reaches some of those people, it can serve them.
Sure hope so.
Yeah. All right, mate. I'm very happy that we've done this one. I feel like it was a great podcast, and I'll see you next time.
I look forward to it, Tom.
All right, aloha.
Aloha.